Hi, this is Dr. Ramin Tayani from the Tayani Institute. Welcome to our YouTube station. This discussion will be about trauma. As you know, I'm an oculoplastic surgeon, an ophthalmologist, Harvard-trained oculoplastic surgeon. What that is cosmetic and reconstructive surgery of the eyelid, the orbit, and the tear duct. With that background, I take care of anything in the upper face from here to here in terms of cosmetic, reconstructive, functional. Functional means anything that is needed so that you can do better, see better, or it's necessary to have better outcome results. Today, this channel, this series today, I'm actually going to be talking about trauma that's related to the eyelid, the eyeball, or the bony socket around the eye called the orbit. So with trauma, of course, anything can happen. A dog bite, a fall, accident, any of those forms of trauma can create an eyelid laceration, which is a cut through the eyelid, or even loss of the eyelid. In those scenarios, we reconstruct the eyelid so that we can have both the best cosmetic and reconstructive functional outcome, meaning the eyelid comes back to its normal form and do what it needs to do, whether it's opening and closing or protecting the eyeball. In those related traumas, basically it could be as little as a small local anesthetic being delivered and then reconstruct with some sutures. In that setting, the reconstruction can take maybe anywhere from 10 to 15 minutes up to an hour or two, depending on the complexity of the trauma. And the post-operative course is that we leave those sutures in place for anywhere from 7 to 14 days, depending on the level of laceration or trauma. And we again try to restore the best cosmetic and functional result for the patient. A second form of trauma to the periocular area is if there is trauma to the eyeball, meaning the globe. There could be a globe laceration or ruptured globe. In those scenarios, there's been some kind of penetration to the eyeball itself. In that scenario, there is a high risk of loss of the eye. Hopefully we can reconstruct and put the eyeball back to be functional, and in many cases I've actually achieved those kind of results with sutures or reconstruction that requires the eyeball to see its best form of results. A ruptured globe typically can lead to reconstruction by putting the eyeball back together, or it may be so traumatic and so extensive that we have to remove the eye. And hopefully that is not the case, but if it is, we typically try not to do the removal of the eye on the date of the initial injury, but try our best to put the eyeball back together, and then at some point in the future date, we might have to schedule a removal of the eye. There's a thing called sympathetic ophthalmia. That is a inflammatory condition where the body senses the intraocular contents as foreign body to the body and therefore fights it with inflammation. So in order to avoid sympathetic ophthalmia, which would be an attack on both eyes, well, the lost eye we don't care about, but the good eye we don't want to lose. So in that scenario, we actually try to get in there and try to put the eyeball back together, or have to remove it as soon as possible to avoid a condition called sympathetic ophthalmia. Sympathetic ophthalmia is extremely rare, and it can happen years later. So patients who have that kind of a ruptured globe where the intraocular contents are spilled out, they need to be examined on a regular basis to prevent or to pick up the possibility of inflammation in the good eye. Going further, if we have trauma to the orbit, which is the bony socket, it could be anything from a complex fracture involving multiple bones around the face, or it could be limited to one of the bones in the orbit, like the floor or the inner wall, the medial wall of the orbit. In those scenarios, we typically use some implant material to put the volume of the orbit back together. If the rim is involved, the rim is the bony socket right in front of the orbit, then we need to use titanium mesh or plates and screws to put that back together. Most patients do very well with that, and our goal is to prevent a condition called enophthalmos, which means sinking of the eye. So we don't want to have a sunken eye appearance, so we do the orbital fracture repair. In some cases, we do a plastic sheet. Is all we need to do to reform the orbital volume and prevent the eyeball from sinking back. So if we use the plastic sheet, it's basically a sheet with pores where the vasculature can actually grow into the orbit so that stabilizes. It prevents infections and motility of the implant. So in summary, the orbital fracture may be using plates to reconstruct the rim, or a titanium mesh, which, by the way, if we do use that, you're going to have to be cautious about your exposure to MRI. CT scans can be done, but not MRI. Or we use the plastic sheet with pores, which gets placed with or without any use of any titanium screws. So in summary, in terms of trauma to the periocular area, we can have eyelid, eyeball, or orbital trauma. And those, any of those arenas, as an oculoplastic surgeon, I'm able to reconstruct and give you the best cosmetic and reconstructive and functional outcome. Hopefully none of you face those scenarios, but if you do, we are able to take care of that and get you the best result possible. The post-op care of those are all very different. Eyelid post-op care may be a matter of having a couple of sutures or a few sutures and may or may not need a patch. If you do get a patch, typically the patch is on for a week. With the eyeball fracture, which is, eyeball rupture, which is a globe rupture, you will have a patch overnight, and hopefully we can save the eye. And with an orbital fracture, typically there's no patching of the eye. There's just some ointment and drops to be used post-operatively. All right, this is Ramin Tayani. Thank you for watching this video, and until next time, have a good day.